Antidepressants are among the most commonly prescribed medications worldwide, especially for conditions like depression and anxiety. However, as their use has expanded, so has awareness of their potential side effects, one of the most significant being an increased risk of bleeding. This concern is especially pronounced with selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, which are often first-line treatments due to their effectiveness and tolerability. Understanding the link between these medications and bleeding risks is crucial for both patients and healthcare providers. By exploring how antidepressants affect the body's clotting mechanisms, we can better appreciate the importance of individualized treatment plans and ongoing monitoring. In this video, we'll break down the science behind these risks, review clinical evidence, and discuss practical strategies for safer antidepressant use. SSRIs and SNRIs work by increasing serotonin levels in the brain, which helps regulate mood. But serotonin isn't just important for mental health, it also plays a key role in how platelets function and how blood clots form. Platelets rely on serotonin to help them stick together and stop bleeding. When SSRIs or SNRIs block serotonin reuptake, less serotonin is available for platelets, making it harder for blood to clot efficiently. This can lead to a higher risk of bleeding, especially in the gastrointestinal tract or during surgery. The risk is even greater for people who are also taking other medications that affect clotting, like NSAIDs, anticoagulants, or antiplatelet agents. While tricyclic and atypical antidepressants have a lower impact on serotonin reuptake and thus a lower bleeding risk, the interplay of medications and individual health factors makes careful assessment essential. Multiple studies have confirmed that SSRIs and SNRIs are linked to increased bleeding risks, especially in high-risk groups. For example, people with pre-existing conditions like peptic ulcer disease, liver dysfunction, or blood clotting disorders are more vulnerable. The risk also rises with age and when other medications that impair clotting are used at the same time. Large-scale research has shown that combining SSRIs with NSAIDs or anticoagulants can significantly increase the chance of serious bleeding events, such as gastrointestinal or intracranial hemorrhages. However, the absolute risk for most patients remains low, and the benefits of treating depression or anxiety often outweigh these risks. Still, it's important for healthcare providers to assess each patient's unique situation, monitor for early signs of bleeding, and consider alternative medications or protective strategies when necessary. Managing bleeding risks with antidepressant therapy involves a combination of careful medication selection, patient education, and ongoing monitoring. For those at higher risk, doctors may choose antidepressants with lower effects on serotonin reuptake, such as certain tricyclics or atypical agents. Minimizing the use of other medications that increase bleeding risk, like NSAIDs, is also important. In some cases, adding gastroprotective agents such as proton pump inhibitors can help reduce the risk of gastrointestinal bleeding. Regular monitoring for signs of bleeding, like unexplained bruising, nosebleeds, or blood in stool, is essential, especially during the first months of therapy or before surgery. Collaboration between psychiatrists, primary care providers, and specialists ensures that both mental health and physical safety are prioritized. As research continues, new strategies and medications may further reduce bleeding risks while maintaining the benefits of antidepressant therapy. Future of antidepressant therapy aims to balance effective mental health treatment with minimal side effects. Ongoing research is exploring new drugs that target non-serotonergic pathways or use innovative mechanisms to avoid interfering with platelet function. Pharmacogenomics, the study of how genes affect drug response, may soon help tailor antidepressant choices to each patient's unique biology, reducing bleeding risks even further. Improved monitoring tools such as platelet function tests and better education for both patients and healthcare providers are also on the horizon. By staying informed and working together, we can ensure that antidepressant therapy remains both effective and safe for everyone who needs it.